And then if I could ask just during the Q&A, if you could kindly put any questions, ideally in the chat. If you prefer not to do that, you can also put your hand up using the reaction buttons at the bottom of your screen. Sometimes this is in the more menu on the bottom right, reactions, and there'll be a little hand that you can use to raise a question. So without further ado, I'll kick off with just a short introduction about the survey, and then we'll move on to a bit more details. So I'll just so hopefully you can see that. Yeah, seeing some nods. Great. So welcome. As I said, I'm Georgina from the Neurological Alliance in England. I'm really pleased that that you're interested in joining us for the next iteration of the patient experience survey. So just in terms of an outline of this morning, so I'm going to give a quick overview of the purpose and introduction of the survey. Then I'm really pleased that Dr. Arani Nitkunan, adult neurologist based in Croydon, is going to give her views on why she's getting involved. And then I'm going to hand it over to Cate and the team at Revealing Reality to discuss what to expect from the survey and the support, and then we'll have an opportunity for a Q&A. So wanted to step back for a moment and just think about the value of patient experience data. So as a survey, this is something we've been doing now. This is the 5th time that we've done it in England. It's the 2nd time that we've done it across the UK. It's the 1st time that we're going to be rolling it out in Ireland. And what's really clear, though, from our experiences is that actually patient experience data about a service is really, really valuable. And we've recently been conducting a series of roundtables and literature review about how the health service uses data from patient experience to inform service improvement. And the real takeaway from that was that it's as valuable as any other data in terms of understanding the quality of your service. So together with things like outcomes data, activity data, and perhaps even staff wellbeing data, it's a really, really good indicator of how well your service is doing. And people who recognise and offer feedback on excellence can also help further the goal of understanding high quality and resilient healthcare, and that's recognised in various kind of academic literature. And we really would like it ideally to have equal weighting with other sources of data, as I mentioned. But also when it's visible in terms of quality improvement practices, it can help to increase the awareness of the skills needed to collect and interpret the data, but also just quality data about your service more broadly. And then finally, I mentioned we've been doing a series of roundtables and literature review on the kind of value of patient experience data to the health system. And you can see there on the right, this is from a healthcare professional who's been involved in some national transformation activities. And their feedback was actually engagement in patient experience is a really empowering experience for them and improve their practice, not only as a professional, but also as somebody who's interested in transformation. So as I mentioned, this is the 5th time that we've run the patient experience survey in England and 2nd in Northern Ireland, Wales and Scotland. We do it in collaboration with neurological alliances across the country. That means that there's about 100 or so different organisations that are involved in terms of patient organisations, certainly. But we're also really pleased to say that we have the support of a number of different healthcare professional bodies as well, such as the Association of British Neurologists, British Paediatric Neurology Association, the Faculty of Neuropsychiatry within the Royal College of Psychiatry, and many, many more. The headline really is that we're going to be collecting responses from the end of July, so from the 22nd of July to the 6th of November. And Cate and Hannah are going to talk about that in a moment in a bit more detail. But broadly, there's 2 ways in which people can feed back at the moment. So one is through an online survey that's going to be promoted both in clinic, but also on those 100 or so member organisations that I mentioned, and via social media. And then we've also got a paper-based version too. There are actually 3 surveys available that we're working on. So there's an adult survey for adults living with a neurological condition. There's one survey for children and young people with a neurological condition. And there's also a survey for those that provide informal care, i.e. friends and family of people affected by a neurological condition. The carers survey is actually something new, but it was very much encouraged by people both affected by a neurological condition and members of the Neurological Alliance who really wanted to see a collective evidence base on that. As I mentioned, this is the 5th time doing it. The last time we did it was in October 2021 to February 2022. We were really pleased that despite working in quite a challenging environment, we were able to get 8,500 respondents across the UK. In terms of clinical rollout, this was lower than previous years. That was largely due to increased infection control measures that were in place at the time due to COVID. So it was a little bit more tricky to encourage people to fill it out in clinic because people weren't necessarily hanging about in clinic. But nonetheless, as I say, we did get 8,500 respondents. And crucially for the adult survey, we were able to provide regional cuts of the data in the majority of health systems in the country, which is really important. In England, on our patch, for example, lots of decisions about how neurological services are funded and planned are now going to be made at an integrated care system level. So having this data at an ICS level, for example, is really important, and that's something that we want to do again this year. Won't go through this in a huge amount of detail, but we had about 35 or so clinics that took part last time, which was great. And there's numerous examples of how that data has been used to support improvement within a local area. So we're hoping to build on that and get even more people involved this time. In terms of who responded, 93% of those that responded to the adult survey lived with a neurological condition. What that means in practice is 7% responded on behalf of people affected by a neurological condition, i.e. friends or family, responding on their behalf. And we found that 59% of adult respondents had a condition other than their neurological conditions as well. It's important to say as well that last time we found that those living with multiple neurological conditions often reported a worse experience of care. In the children and young people survey, the opposite was true in terms of who was responding. So 87% of children and young people respondents were actually responded by a parent or a carer or guardian of that child or young person. And then in terms of the adult survey, the most reported conditions were MS, epilepsy and migraine. And typical of other patient experience surveys, we did see an overrepresentation of females that responded to the surveys. That's something we'd like to address this time. And we had a good age range of people responding to the survey last time as well. 2 other points about this. So one is that we found that those living in more deprived areas often reported a worse experience of care, but we also found that we were less likely to receive responses from those living in more deprived areas. And we had a very high proportion of those identifying as British and white, certainly not reflective of the population as a whole. So that's in terms of equity, we'd certainly like to improve on that this time. So now I'm going to move over to Arani to give just a few moments on why she's getting involved, and I'll stop sharing this for the moment so she can do that. Thanks.
Morning, Georgina. Can you hear me all right? Great. So just to introduce myself, I'm Arani Nitkunan. I'm a consultant neurologist working here at Croydon and also at St George's, which is in southwest London. So I became a consultant about 11 years ago, and during my training and as a consultant, you get feedback from patients. Sometimes they tell you directly, either by letter or email or during the consultation, how good or bad you are. And as a trainee, I used to find that really difficult when it was negative feedback, but I have actually learned with experience and a bit of maturity that it's actually really, really helpful to get that one-to-one feedback. And then, of course, as part of our appraisal and revalidation process that the General Medical Council have set up, we have to do patient surveys every, I think it's every 3 years, when we ask a group of patients what they think about the care I provide personally. Now, this survey by Neurological Alliance is different. So it is not feedback on one individual, but on the whole pathway. And this is why it's so incredibly valuable. The patient's voice is so strong. And just to give an example of that, when I started here at Croydon, we had no nurse specialists. And a patient complained to the hospital saying that we didn't have an MS nurse. And we were in the process of building a business case for that nurse. And when I passed the chief executive in the corridor, he asked me, how come we don't have a nurse? And I was like, oh, that's great that you're asking me, because he had sight of the complaint. And so he was asking me what I was doing about you know, getting a nurse specialist, which is wonderful, because usually we have to go around with a begging bowl wanting funding for various things. And you know, it was the other way around. So this patient voice is so, so important, and it will hopefully help us build the services that the patients need. So, you know, I think from a sort of clinician's perspective, it's, you know, if you perceive it to be a sort of personal feedback, you might get nervous about it. But this is the one thing that, you know, we should reassure ourselves about. It is not personal feedback. This is feedback on the system, of the pathway, the process, how patients can access our services. And it actually pulls up things that sometimes I hadn't thought about. So just to give you another example, the last survey showed, I think, that 74% of patients, off the top of my head, so correct me if I'm wrong, said that they would have preferred more information about end-of-life care, and they thought that conversation would have been relevant to them. So, and that is something that I've reflected on a lot in my practice, and you just try and think about what you can personally do to change that. Now, of course, there's lots of other things, like how long it takes patients to see a consultant or an allied health professional, or including their specialists. So all these pieces of information are really helpful in our fight to be heard, so that we can provide the service that patients deserve. I will stop there, and happy to take any questions. And just sort of to reflect that actually, you know, because of all the sort of feedback we've got, we've now developed our services in Croydon. We now have 5 nurse specialists. And hopefully we're providing better care for patients, and we're looking forward to seeing the outcome of sort of the local result for this next iteration of the survey. Thank you.
Great. Thank you very much for that, Arani, and we'll come back to questions in a moment, but hopefully that's a really practical example of how this can hopefully help your clinics. So I'm just going to go back to our slides. So I'm now going to pass over to the Revealing Reality team to give a bit more detail on how we're approaching developing the survey and what's in it. So please, Kate and Hannah, over to you.
Hi, thank you so much. And thanks, Georgina, for having us this morning. I'm Hannah. I'm an associate director at Revealing Reality. As Georgina said, we're the research partner for the My Neuro Survey this year. And we're really excited to be working on a piece of work that has such huge potential. I mean, hearing you both introduce it this morning, it's obviously piece of work that has so much like opportunity to really kind of drive home what patient experiences are like at the moment. And it's wonderful to be talking to you all this morning as well. Apologies about my camera. I've just had a big Cyber Essentials reboot of my computer, which now means I can't use like half of the function of it apparently. But hopefully for tomorrow morning, I'll get that sorted. Georgina's obviously done a great job of kind of introducing the survey and what we're doing this year. So I'll quickly touch on this slide before handing over to Cate. But the surveys this year are really an opportunity to explore what it is like to live with a neurological condition or care for someone with a neurological condition. And there's obviously so much that we can do with that, but the ultimate goal is obviously for you all to be able to take it forwards and, you know, inform future advocacy, to kind of influence and drive home service improvement for people with neurological conditions. On the next slide, Georgina, sorry, we've outlined here a very high level what we're covering here with the adults and the carers survey. Obviously, there is a lot of detail within them, and some people have been able to give feedback on them already, which we've hugely appreciated. But the key themes of the surveys are obviously learning about the person who has the neurological condition, whether that's coming from them or being filled in by a carer about the person that they provide care for. And this includes demographic information and information about their condition and how it affects their life, but also thinking more broadly and more holistically about the overall impact of the neurological condition. So thinking about questions about mental health, physical health, finances, social. So these are all themes and topics that are hugely prescient at the moment. And so being able to kind of tie this in and look at how this works for people with neurological conditions is obviously a huge opportunity with the survey. And then finally, we've also got lots of questions about people's experiences with different touch points. So whether that's health and social care, thinking about all the different parts that they are interacting with, different staff that they're talking to, whether that's specialist or non-specialist services, but basically thinking about the information that people are receiving from a patient and also a carer perspective. So really trying to drive home this data into the perspective of people with lived experience of interacting with these services. Georgina and Fola have been kind enough to share some of the examples of how information like this has been used in previous waves. So being used for service improvement, but also at more localized levels. So all of this information will be able to give it more broken down levels as well. So thinking about regional and local levels, and all of this is really great, and there's so much potential with this piece of work. But I just wanted to pass on to Cate on the next slide to talk a little bit more about the nitty-gritty of how hopefully we can get your guys' support for the promotion of the survey.
Hi everyone, morning. So yeah, we're really excited by this survey, and obviously we want to reach as many people as possible because that's going to make the quality of the data like all the more rich and bring greater insights. So I think we've already mentioned that we're aiming for at least 12,000 responses. So it's a great number. And with this in mind, we need and really appreciate your help as clinics to help us like reach those numbers. So to make survey dissemination as easy as possible, we're offering some support to just make it work smoothly, essentially. So just to recap, there are 3 different ways that people can fill in the survey. So one is just through the online route. So that will be from accessing the QR code from the poster or via the links that you can send out as clinics. And the second route is just via the paper copy, which people will be able to find in clinics. And finally through telephone, because people can ring us up and do the survey with us over the phone. And there's 2 key routes that you can use to promote the survey, essentially online, by email, text, social media, and in clinic. And you might have your own ideas about how is best to do this. but maybe it might be a good opportunity to promote the survey when someone comes to reception and is waiting for an appointment and they've got that spare time. Yeah, and so we've got a few little bits that we'd love to send your way to help with dissemination. So definitely we'll send you drafted comms written in an inclusive way with all the relevant information about the surveys. Should be really simple to just get that out there. So that kind of information will include, you know, a bit of background to the research and people's like options for getting involved and what participation involves essentially. But of course you can, you know, you can tweak things to kind of align with like as you wish. And we'll also send your way some posters which you can include in clinic, and they'll have a QR code on them. So it should be really easy for a patient to access it that way, kind of accessing it from their own device, or if you have any in clinic as well, any sort of like spare devices that people could fill the survey on, that could be a great opportunity as well. Be really smooth. And we also can send your way a questionnaire pack, which will have up to 100 copies of the paper survey, as well as sort of a cover letter with more details about the research in case any of your staff need a bit of a refresher. And then we'll also send you some free post return envelopes, just so it's really easy at the end of the survey being in field. You can just pop all the surveys in there and send them back to us to be analysed. And also there'll be an option to request a ballot box, just a place to store the surveys if you like, which you could keep in the waiting room, for instance. And also we're really excited to be able to send you guys monthly updates on the response rates from clinics, just so you can get a sense of where the numbers are at and kind of give you that motivation to keep going and keep pushing. Yeah. So on the next slide, we just wanted to run through a few top tips for dissemination. So yes, essentially, these aren't like a definitive guide, and it's probably a case that when you start disseminating the survey, you'll figure out your own ways that seem to be more effective, effective ways of reaching people. And actually, we'd love to hear if you find some routes that really work. Please do let us know, because that's really exciting to share that knowledge. But we had some ideas already, just as a starting base. So we were thinking that having a think about what's the right moment, ask people to fill in the survey, potentially could be a really good one. We already mentioned of just when people are waiting for an appointment, they've already got that time. But there might be some other moments of like the patient journey in clinic that you could think of. We were thinking it would be great if you could think about the best place to put up the poster that's most visible. Also from the last iteration, I think it was found that direct email and text can be more impactful in terms of encouraging responses. And it's possible that that could be targeted also to certain people if we're missing you know, some demographics, for instance, in the sample. Because one thing that we want to keep in mind is, as well as reaching the highest number of participants as possible, we also want to keep the sample as diverse as possible, just in the interest of that. And you know, that's one of our biggest kind of priorities for this iteration, is keeping diversity in mind and reaching people that may be less likely to fill in the survey for whatever reason. And yeah, we really appreciate that you might be able to help on this front. And we'll be sending, like I mentioned, those monthly updates that kind of tell you about who's like the numbers of who's responded, and that will be broken down by different sort of demographics. So that will kind of help keep an eye on that one. And lastly, of course, it'd be great to keep your survey leads feeling confident about the different promotion routes and just confident with the work they're doing. And we can talk a bit more about that later. But I'm happy to pass back to Georgina and Follow, I think, who are going to talk through different motivations, a little more motivation for dissemination.
Great, thank you. So Hopefully this is a little further motivation for you. It's the first time we've been running this, but we're going to have some light-hearted competition to encourage promotion. So essentially we're going to have and it's an Olympic year, no less. So why not have a gold, silver, and bronze scheme? This is something that we've been working on with our various healthcare professionals and patient groups involved in this. So really pleased to have developed this collaboratively. So essentially, if you receive 5 responses for your service, we'll share a certificate of recognition, that recognises your commitment to patient engagement as a big thank you. And of course, as a supporter, we'll mention that on our website and your contribution to my Neuro Survey. At 21 responses, this is the minimum number required to receive a bespoke report for your service. Essentially, that will allow you to delve in more deeply. The reason why it's at 21 is because that we are confident that would mean that we would be able to protect anonymity, and we'll also engage with your local health boards and/or ICBs as appropriate. To highlight your involvement as an exemplar in terms of patient engagement and involvement. And again, you'll be featured on some of our communications channels. And then at gold, you'll receive a trophy recognising your commitment. You'll need 100 responses to achieve this. Again, we'll feature you in some of our communications, but this time in our newsletter and the blog. You'll also receive a customised report, and then we're very happy to have a one-to-one consultation with you to discuss the report findings and/or contribute to any other presentations that might be helpful within your area, just to recognise how much support you've given to the survey and hopefully got some really helpful insight out of it. So in terms of what we need from you now, many of you have already done this, so thank you. You've already submitted 3 contacts for your service. So we're just compiling that at the moment. We've had, I'm really pleased to say, about 15 clinics already sign up across the UK. So really confident that that's continuing to grow. We're going to send over a short form just to confirm some of the logistics around this, but also understand your preferences, because every clinic is slightly different in terms of how it's set up and its preferred dissemination routes. So it will just provide an opportunity for us to understand that in a bit more detail from you. And then in turn, what we'll do is it will arrange for that support for dissemination, as Kate's gone through already. And we will also provide you a fuller briefing pack no later than the 15th of July. We've had many early sign-ups, so as I mentioned, so we'll start to get those out as we understand your preferences. So sooner rather than later. And that's it for the moment. So now's an opportunity to hear any questions or comments, and/or if you've got any preferences that you're aware of already. So please do either pop your question in the chat or please put your hand up. That'd be great. Thank you. Okay, that's absolutely fine. No questions for now then. And Arani has stepped out. She had a clinic, but hopefully that started to give you an idea of how the data could be used. The other perhaps method to mention that I know Arani found particularly useful was, if possible, sharing it within clinic letters. It does require a little bit more arranging, if you like, but it can be really, really useful, and even including perhaps the QR code. And then the other point to mention is that your kind of buy-in as a clinician is incredibly powerful within clinics, so continue to promote it with your colleagues and so on is incredibly useful and really does help with uptake. So final moment for any questions. No, all very straightforward then. Good. Brilliant. Well, thank you again for expressing your interest. We'll be back in touch shortly with, as I mentioned, that short form. Really confident that we're going to have the biggest and best and most inclusive survey yet. So thank you in advance for playing your part in that. And you know where we are if you have any further questions. Thank you.
Thanks. Bye.
Thanks. Bye.
Thanks.